Thank you for joining us for session number 9. This is the 9th Friday show we've done, so we are scheduled through the end of June. So we'll kind of reassess and see where we're at then. And
so Heike,
with that, yes.
We give Val just a few seconds to get here.
Oh, absolutely.
Okay. Hang on a minute.
A little bit later this morning. Thank you for your patience. I know I just looked, we're up to 400 people on the webinar today, and I know those will continue to go up. Not a lot of new information today. The Fusion team continues to meet on testing, and this week we pushed, the Department of Health and Senior Services pushed out new testing guidance that supports the testing of symptomatic and asymptomatic folks, especially if there's an epidemiological reason for that. So hopefully in parts of the state where we are struggling to get asymptomatic folks tested, that will become easier. Feel free to refer to that if you need to, that new guidance, and we did send that out to all the providers as well, and it's on Health and Senior Services website. There was also some information around serological testing this week that we put out as well. I know we get some questions from folks around serological testing. That's the testing to see if you've got the antibodies that says maybe you've already had COVID-19. Still at this point in time, there's just really not enough known about COVID-19, the coronavirus, and the impact long-term of your exposure if you're going to get it again, how long you're immune if you've developed any immunity. So there's a lot of questions around that. So while serological testing does give you data, knowledge that you have or have not had COVID-19, it does not, there are no CDC recommendations at all that say somebody that has an antibody test can, work without PPE or anything on those lines. So do not use serological, and I'm going to repeat this again, do not use serological testing results to make decisions around staffing, quarantine, isolation, any of those things. So I want to make sure people are aware of that. And again, that guidance is out there as well. Testing really is just information at that time. So, and we all know this, you're negative one day, you're positive the next day. So negative testing, you still need to be monitoring for symptoms, and you need to be watching folks very closely, especially if they have been in contact with someone who was COVID positive. PPE, we also pushed out some information around PPE yesterday. Department of Health and Senior Services has kind of launched a one-stop shop PPE website, and that website includes how to get to that Google Marketplace, which I have over 1,468 buyers have registered on the Google Marketplace, and there are 529 suppliers on the Google Marketplace. So that's really good. I know we still have folks struggling to have orders big enough to be a player on the Google Marketplace at this point, but that's how a marketplace is. So don't give up on the Google Marketplace. Keep going there. As more supply becomes available, order sizes will decrease. But there's a third thing that got added to that website today, and that is, or yesterday, and that's a statewide order option. So the state, recognizing that you've got to be a relatively large purchaser, is going to be working to make more purchases of PPE. And as healthcare providers, we are in tier 1 of providers that can access this PPE if we need it. And there's a process that you will need to go through on that website to access the PPE. So again, please look at that website, familiarize yourself with all the things you need to be doing, and there could be more opportunities for PPE there. There's a whole ordering process. Also included in what we sent out yesterday around PPE is a reminder that not-for-profits and governmental entities can access hand sanitizer, gowns, and face coverings through Missouri Vocational Enterprises. Now, MVE does not have a lot of that available today for purchase by outside of state government, but again, they will in the future. So please try to work those channels as well. Gowns continue to be a real struggle to get, and so do N95 masks, which takes me to the Battelle system. That is operating in Missouri. If you've got N95 masks, please make sure you're part of the Battelle system so that you can get those cleaned and reuse those masks. We've heard from a lot of providers that that's great and we'll sign a contract, but we don't have any N95 masks. So it's not particularly useful at this time. But again, it's a tool out there. We want to make sure that people are using this. And when we talk about PPE, we just want to continue to remind people this doesn't change on June 1st. Your need for PPE doesn't change on July 1st. This is long going. This is outstanding. We may, like in one of our facilities, we're hitting a 16-day with no new positives. We're very excited about that. But we also know that that can change very, very quickly. So don't rest or relax because you're starting to see some things decrease. You still need to be prepared if there's another wave, when there's another wave. The other thing we're talking more about are hotspots, and I think a lot of you are familiar with some of the facility-based or meatpacking-based outbreaks in Buchanan County. I know they're doing some testing in Sullivan County and potentially some testing in North Kansas City, I believe. This weekend also, they are doing some community sampling in Buchanan County. So you don't have to be symptomatic, asymptomatic. You can just show up at a site and get a test. Now, you do have to pre-register for that, and we did push that information out earlier in the week too. But I highly, and the same as for Pulaski County, to find out about these things, I highly recommend that you all follow your local county health department, your local public health agency. You need to be following them on social media. They will post if they are going to be having a community sampling event in your community on those social media platforms. So if you are not following your local public health agency, you need to be doing so, because that is going to help give you a lot of local information, data that you need to help make decisions, and also will inform you of those community testing sites. So that, I know, just anecdotally on the testing side, it continues to be a struggle for folks, and we continue to work with folks individually as those come up to try to find testing solutions. If, as always, if you feel that you need to get testing for residents or staff, please work through your regional office. We have a process for that. If you have a positive, we will reach out and contact you. So that's kind of where we're at there. Budget update. I know yesterday the governor announced that we were going to be having to do more withholdings to start FY21. The department is working on what those withholdings will look like at this time. But it's a lot of money, and it's a lot also dependent on what happens at the federal level and the timing of what happens at the federal level. So remember, our fiscal year starts on July 1st, which means our FY21 budget starts on July 1st. So if the federal government makes a decision to give states money in August, that helps us from August forward, but it doesn't change those decisions that have to be made in June to be implemented in July. So federal action is really important as we try to figure out how much funding we will need to come up with to make sure the state operates under a balanced budget. So stay tuned on that. We don't have any decisions on what those are at this time. We're not going to speculate on what those are at this time. We will wait and announce those when we know what those are. But we will be working with them on solutions for that. The CDC actually pushed out some guidance, which we will be posting to our website. It's reopening decision trees. It's not specifically for our world. It's about summer camps, workplaces, restaurants, bars, childcare, schools, and mass transit. They are good starting points for ways to think about how you reopen and how you reintegrate reentry into the world for those populations. So as you're making business decisions, some of these kind of decision trees could possibly help you decide if you're ready or how you're ready or what you're missing in order to be able to move forward. And we'll continue to work on some decision trees to help people kind of make those decisions as well. We did get some questions that I'm going to address. We had a question on, do you have any guidance on staff returning from vacations to face-to-face support? Currently, and before this started, or, you know, we're about, 12 weeks into this right now. We were saying, you know, had you just come back from a cruise, then you've got to quarantine for 14 days. Had you just come back from these countries, you've got to quarantine for 14 days. It's different now than it was when those decisions were made. Not a lot of traveling is happening right now, so we as a department have not made the decision of how we're going to reconsider what we do for people that have been on vacation or what kind of leave we'll require them to do when they come back from those types of vacations. But I think that's something we all need to be thinking about, especially as summer approaches us. So I don't have an answer for that question, but I'm just sharing with you how we're thinking through that. Another question is, will providers be penalized in any way if they do not allow all participants to return for safety reasons? What alternatives will families be offered if they are now not currently appropriate candidates for group service? And I like this question a lot because it lets me talk again about how individualized everything we do is and how you do have to plan this at an individual level, but that you're also, those individuals are also part of a community, and that community can be in their home, and that community includes other people that they live with, and it includes their staff. And we know that we have a lot of staff that work for us that are immunocompromised, and we have a lot of individuals that we support are immunocompromised. So you really have to take all of that into consideration. No, the division is not planning any penalties. There's no special work group discussing penalties or regulations at this point that we will require for reopening. We're all still learning, and I would not do any penalties for that. But we are all still learning on what type of regulations need to be in place if you're looking at reopening. And I don't really see that, again, as a regulation opportunity. I see that as an individual planning opportunity. So those are the questions we have. We also got a story from the field, and I'm going to share this story because it speaks a lot to the anxiety that's out there right now and some frustration, and it's even frustration that I feel when I go to the grocery store and I'm wearing my mask and I'm using my hand sanitizer and everybody else is not. So every Friday, and this comes from the Platte County Board of Services, every Friday I've been sending a message to the Platte County Board of Services staff. A recent one talked about hitting the wall and ways to cope. I got this in response from a direct support professional. Let me share with you something I wrote when I felt I was hitting the wall. It's a bit long. I hope you enjoy it. Feel free to use it or any part of it you want to encourage others to stay strong and stay safe. I'm not stressed or worried about the COVID-19 virus. I'm stressed by the people who don't take it serious. I'm an essential worker. I work with an extremely vulnerable population. Our individuals are taking this very seriously, even though they don't always understand what is going on. And they are relying on us to take care for them and their safety. What concerns me is myself and my coworkers have to do grocery shopping for ourselves and for individuals we care for. This means shopping twice as much as the average family because we have two families to look out for. We don't want to be exposed or expose anyone to this virus. On top of this, we are working tons of extra hours in order to keep our individuals safe in their homes. Yes, I'm thankful to still be able to work, but we don't have the options to work from home. We're away from our homes and our families. When we go home or when we arrive at work, we have to take extra precautions. I'm not asking for applause or other recognition. What I'm asking is for that people take this seriously. If not for yourself, then please do it for someone you care about. My individuals' lives matter. We are all in this together. Please don't be selfish. Stay home, stay calm, and be thankful for every day. I respect all essential workers out there putting their lives on the line. I just feel I needed to speak up for a population of individuals that aren't being recognized. My agency and coworkers are taking this very seriously. I love the agency, coworkers, and individuals I work with. Please take this seriously. And that is the same message that we at the Department of Health share with our employees daily. You have to take this seriously. And it's going to be hard to continue to be vigilant and to continue to do those things when we see other people not. But every little bit helps, and that's really what we're working on right now. So with that, we're up to 480 on the call, and I'm going to turn it over to Wendy. And Wendy, if you're talking, no one can hear you.
Damn it, there it is.
We hear you.
You hear me?
Yes.
Okay, thank you. Sorry. So good morning, everybody. Earlier this week, I spoke with the SLABS group, which is a group of day program providers out of St. Louis. And so some of the questions that you're hearing today are questions that came up in that discussion, and I thought they were really good questions and would have value for the rest of the audience here to hear as well. So one of the questions was, what guidance will be issued to transportation providers as to how many people can be transported on their vehicles and what precautions must be taken. So again, this is very individualized. It depends on so many factors. Like everything else, there's not a black and white answer. Is the transportation provider using a 4-door sedan, or do they have a 15-passenger van, or is it a minibus? Do the people that they're picking up live together in their homes, and so they're already exposed? They can sit together maybe in the back seat of a car. But if you're going from home to home to home and picking up multiple people, then there's going to have to be consideration given for all the precautions that need to be in place, the sanitation of the vans, the social distancing within the van, the capacity of the van, individuals' ability to wear masks and PPE and those kinds of things. So I know we sound like a broken record, but it is just very individual based on the provider, their route, the people that they're picking up, and also the comfort level of the people and the families and providers that they're picking up from. So everybody is being very diligent about minimizing exposure to the rest of the people that they're around. So unfortunately, we don't have just a black and white answer on that. And then the next question is, the transportation crisis that existed prior to the COVID-19 emergency still exists and is likely exacerbated by the emergency. Is the division planning for alternative means of providing for or funding transportation in the case of transportation providers are not able to continue on with certain routes due to limits on passengers, et cetera? I just want transportation providers to understand and to know that the division understands the difficulty that they're facing, the financial difficulty that they're facing, and we've already gotten a couple notices from a couple providers that aren't going to be able to continue providing transportation, and it's understandable. And I think, unfortunately, there's probably likely going to be some more that aren't able to keep up with this demand given the current circumstances. But as I shared earlier with this group, this is really the same story for so many of our providers. Day program providers are going to be bringing people back in smaller groups, and the division does not have the ability to just adjust rates to account for these smaller groups and all that. We can only do what we are appropriated money to do through the legislature. So it's not as easy and simple as just making a rate adjustment to accommodate for that, because we are really operating under some very, very tight budget constraints. So please know that we understand, and we are doing all that we can given the circumstances. One idea that came up in the discussion, and we will have some internal conversation about, is there a way to reimburse parents who may be providing their own transportation to get to activities and to programs and services. So that is something that came out of that I think we can look at and talk more about. Another question is, current closures, buying PPE, and having to limit the number of program participants on site has created significant financial strain on all providers. What suggestions does the division have for what providers can do to stay afloat? Are there any further advocacy efforts underway to provide some relief for day providers in order to prevent permanent closures, potentially on a large scale? So again, we understand and are aware of the stress that our providers are under from a financial standpoint. I think we've had a number of providers who have been successful in getting the PPP loans to help with their payroll. I would encourage everybody to be very familiar with their Small Business Association website and all the financial financial aid availability through the CARES Act and other sources that are coming down from a federal level. Stay on top of that. I think this is a time for day providers to be looking at what of their services could be provided in the family home. Could some of their goals be transitioned to individual skill development when they're ready to go out into the community? Could it be done as community integration rather than a day program service if you've got people who are not comfortable coming back to a group setting? So I think it's just really looking at, this is an opportunity for you to reinvent your business, so to speak. So we're happy to brainstorm along that. If anybody wants to have some brainstorming sessions, we're happy to help in any way we can there. In terms of advocacy efforts, I'm going to invite Val to chime in if she has anything that she wants to speak to there, but know that we are always advocating for our providers. We understand the financial difficulties and the rate difficulties, and Val is working at the Capitol daily, it feels like, to make our needs be known. So Val, did you want to add anything in there about our advocacy efforts?
No, I mean, we talk about it a lot. I'm good.
All right, so I'm going to move on to our Frontline Heroes. I've got some Frontline Hero stories, and this one is about Harriet M., who works in St. Louis. During these tough times, she has remained a constant presence working with the ladies in the home she is assigned to, even helping to maintain coverage in other areas. So thank you, Harriet M. Alicia T. works in St. Louis. She has worked with a home that has positive COVID-19 clients and did not miss a day. She came in and performed her job exceptionally and with a positive attitude day in and day out. Angela G. works in St. Charles. Angela comes to work daily and gives her all for the betterment of the facility. She jumps in and assists wherever she is needed, no questions asked. She is a true hero, and we are grateful to have her on our team, a true team player. And finally, a story about Nick N., who works in Osage Beach. This is a real story of perseverance and resiliency. Nick has had many struggles throughout the years, but after moving to this area and finding a job he loves, he is doing great now. Nick began at the local sheltered workshop when he came into the services with me, but realizing he wanted more, he quit working there, and without help from anyone, he applied and was hired as a local retail business. Nick was sleeping in a tent for a while because he couldn't afford a place of his own, and he did not want to bother his parents. He did not tell them where he was sleeping. Within 6 months, he was living in his own apartment with his girlfriend, and he lost his SSDI because he had exhausted the Ticket to Work program, but Nick kept working. Now, out of a bad relationship, Nick is stronger than ever. He has a new one-bedroom condo. He pays rent, utilities. He is days away from his one-year anniversary with the local retail business. He has an amazing relationship with his family, and Nick has continued to work throughout the COVID-19 pandemic without a second thought. He works what he is scheduled, and when he is called in, even if it is his days off, he goes in and works. Nick's next goal is to become a full-time employee with the local retail business. Nick smiles all the time now. He works through the cold weather and the same smile he has when he's hot. He is a great person who has been working throughout his whole pandemic and will continue to work frontline helping customers, and whatever their needs are. And he does so with this amazing attitude and a great smile. So thank you, Nick. That is a great story and should inspire all of us. And with that story, I'm going to turn it over to Gary.
Hello, everyone. I just want to touch base on something we had been talking about before, everything started with COVID, but our case management system, as some of you probably remember, we did an RFP for a new case management system to move our business out of Seymour. That is still going on. We are in the process of, we're getting 90% match from CMS on that. We're just in the process of working through some of that paperwork. Currently, the award is under protest. We expect that to be resolved any day, so we're just waiting for that to be resolved, and we're going to begin work. Some of you may have been with Station MD contacted by Toy Wilde. She's leading the Station MD implementation, but she is going to be the full-time project director of that and directing some other projects as well. But so you will probably become familiar with TOY as we move to when we start moving with our case management system. With that, I'm just going to go through Frontline Heroes. I got some stories of my own today. So first one is Gonzetta. She works in St. Charles. She's helped us out in isolation home to ensure our clients have the care they needed. It is a challenge in itself to agree to work in isolation, and you have to truly give of yourself, and she stepped up to the challenge. A true hero, and we thank you, and we all thank you. Story from the field. This one is from Developing Potential, Kansas City. So during the COVID outbreak, many individuals who were employed and supported by DPI, Employment Connections, have been unable to continue to work due to stay-at-home orders. So DPI is making sure that the individuals have an opportunity to stay connected. The DPI Employment Connections team has been able to support individuals through telehealth using Zoom and an online face-to-face meeting tool. The employment team has taken this time to think outside the box and ensure individuals remain engaged and continue to work towards their employment goals. Individuals in the employment program have been able to participate in job-related games such as Job Jeopardy and Family Feud. These activities have been created to include topics and scenarios referencing teamwork, employment application information, building relationships with natural supports, and qualities of good employee. They have also participated in various types of curriculum to enhance their current job skills. Individuals who are not employed yet have been able to prepare for interviews, build their resume, work on their discovery workbook guide, apply for jobs, and partake in virtual interviews with employers of their interest. The DPI will continue to ensure that during this difficult time, individuals continue to be supported with achieving their employment goals and stay connected while remaining healthy. And a big shout out to DPI. And with that, I will turn it over to Angie.
All right, good morning, everyone. I get the pleasure of sharing some stories from the field with what's going on with Emmaus. So we have a couple of stories here. With Emmaus, there's over 275 adults with developmental disabilities that they support. While they shelter in place, they have a large community of volunteers making it possible to experience meaningful activities from home. The Emmaus Homes Facebook page hosts a live video every day at 11 a.m. There have been many talents showcased, such as exercise, church, video games, bingo, charades, live music and concerts, gardening, crafts, and even a live tour from France. So that sounds pretty cool. Many of these live events have been hosted by volunteers, but even clients of Emmaus have been able to join in the fun. This week they have a party that's being hosted by one of the homes that they support, and one client is hosting a guessing game of what's in the box, and screened guesses coming in from the comments. More have hosted live cooking shows, and there are clients that have added hosting a Facebook Live video into their ISP for future goals. So that is pretty exciting. The other thing they want to share is that Quail Creek's Victory Garden. They have some ladies that decided to grow their own vegetables and herbs to remain healthy throughout the coronavirus, and they thought this was a way that the ladies could see how to be resourceful through tough times and turn it into something positive. So they are challenging other homes to make their own victory garden. And with those, thank you, Emmaus, and clients and everyone that's taking part in those Facebook events and growing those gardens. So with that, I will turn it over to Kim.
Thanks, Angie. Good morning, everyone. As Val and Wendy had mentioned earlier, we've been receiving some questions around individualized planning and HCBS services. So as a reminder, I just wanted to share with everybody, and Heike has our screen shot up right now, that the division has posted on our coronavirus COVID-19 webpage information and resources that we're hoping will be helpful to individuals and your planning support teams when you're making those decisions around when you want to access and utilize HCBS services, which are very important decisions. Additional information also is posted on the division website regarding individual rights and due process. And so those hopefully will be good resources for you as you work forward in making those important individual decisions. Another quick reminder is that we also have posted out on the division website information for our HCBS home and community-based service providers when you're making those decisions regarding reopening. And so please, hopefully you'll utilize those resources and find those helpful. I also have a stories from the field to share today, and this one is specifically around Station MD services, which the division is really excited about having the opportunity right now for waiver individuals to be able to access this service. As a reminder, Station MD is a telemedicine service, and it is currently available right now to all DMHDD waiver participants. We do have a designated web page out on our division website that is specific to Station MD. It will support you with understanding how to access and utilize the service. What we're hearing is it's pretty easy. You just basically need the ability to have a working phone to be able to actually utilize the service. So the story that I'm going to share today was submitted from an agency, and it really highlights the value of being able to use telemedicine during these times, in that they were supporting an individual who was experiencing some elevated blood pressure readings, and they were communicating with the individual's primary health care provider and having some difficulty kind of getting connected to get that individual evaluated and screened. And so they went ahead and accessed the Station MD service directly. And what happened was the Station MD service then contacted the primary health care provider directly based upon their telemedicine evaluation. And the individual received a scheduled visit with their primary health care provider that morning, and was able to be assessed and prescribed medication. And so that was just a really great example of how Station MD can be an ancillary telemedicine support to meet the needs of individuals right now. So again, hopefully everyone is aware of the information and you're out and looking at how to access the service if needed. And at this time, I think I'll turn it back over to Val to see if you have any closing remarks.
Thanks, Kim, and thanks for ending on that Station MD, because I think we're getting a lot of unintended positive consequences from Station MD, and I think that last story was a really good example of how our direct support professionals know the people they're supporting, and our nurses out in the field know the people they're supporting, and when they don't get listened to by medical professionals, and then Station MD turns around, listens to them, and validates their concerns, I mean, that is an unintended positive consequence. You know what you're doing. You are good at your job. So just, I like it because of all the other cool stuff that we're getting out of it, not just the fact that we're getting better care for the individuals we support. We did have a couple of questions that came in on the chat line. So the first question was about eligibility for stimulus checks, and they're hearing that individuals who have guardians are not eligible for stimulus checks. And I'm going to turn it over to Gary because he's got real life experience here.
Yeah, I'm not sure where that came from. We know that we've received checks for individuals who have guardians because the guardians have requested the funds. So we know they are. We know that we haven't received all the stimulus checks yet. They're still rolling out. So I haven't done a check lately of how many we deposited, but we know they're still rolling out.
So thank you, Gary.
Yeah.
The other question we got was a question around guidance around DMH individuals to wear face coverings during face-to-face visits. And again, that is going to be an individual decision. We are going to have some folks that can wear face coverings successfully. We're going to have some folks that can learn to wear face coverings successfully, and we're going to have other folks that are not going to be able to wear face coverings. And so that's stuff that we are going to have to figure out with our individuals. And I can tell you that with our rehabilitation centers, working through isolation, we were successful some places, and some places we are not successful at all. So again, it's really individualized. So there's also some medical concerns to look at whenever you're looking into that kind of stuff. And Kim, I don't know if you had anything, and you may not, but I know we were working on some stuff around face coverings and things to look for.
Yes, we are.
Stay tuned and we'll help with guidance there, but again, it really is individualized. But don't forget, I mean, just like all of us are learning how to wear face coverings, and trust me, we teach people every day, you know, you got to wear it over your nose or it doesn't really matter. I know when I was in the Capitol, some folks were poking holes in their face covering, and I'm like, so, you know, that doesn't really matter now. So just, I mean, everybody is learning how to wear face coverings too. So let's not forget that people can learn how to do that and become more accustomed to it. That is all we had. We almost got to 500 callers today. 498 is the highest number I saw, but Heike may have had a different number. Again, like we do every week, I cannot thank you enough for the work that you're doing. I cannot thank all the people that work for you. I can't thank all the individuals. Everybody is doing a really, really good job of following what's out there and understanding, learning, getting information. And again, it's just really been great. So appreciate everything everybody's doing. Have a good week, and we'll continue to communicate through the week and talk again next Friday. Have a good weekend. Bye.